All right, I told you that panel wouldn't disappoint. I don't think I'm ever going to look at coffee the same, especially the idea of eliminating the intermediary from getting the currency straight to the farmer. I thought that was absolutely brilliant. So from farming to healthcare we go. I have a really great panel coming up next that's going to talk about a blueprint for sustainable access to surgical care in partnership with Operation Smile, where these two dynamic speakers will delve into the transformative power of the hub and spoke model and other sustainable approaches in transforming healthcare delivery around the world. Please welcome to the stage Betsy McKay and Kristie Magee Porcaro.
Thank you. It's great to be here with you, Kristie. I thought we should start with, for those here who don't know Operation Smile, what it is and what's your personal connection to it.
Sure, and thank you, Betsy, and thanks, Concordia, and all of you for being here. So I actually have a little bit of a nursing background in the work that I do, and then did consulting for about 5 years. I am privileged and blessed to be Bill and Kathy Magee's daughter, so the founders of Operation Smile. So 20 years ago, I came on board. Operation Smile was started in 1982, 42 years ago, really around just cleft lip and cleft palate. But as we drive to the future, what we know after 42 years is that we are a locally led, globally driven organization. And what we've also learned over 42 years is what our patients go through and the barriers that they face in these communities. And so I think we're here today just to learn what our patients see, what they go through, and then how Operation Smile, along with all of you, can partner to create change, better access to healthcare, better access to surgery, really for the communities that our patients live in.
So Kristie is Chief Strategy Officer at Operation Smile. So we're going to talk strategy for a minute since that's your job. You are implementing a new strategy in a huge world of need, surgical need, like 5 billion people, right? Lack access to safe surgery. So can you walk us through what the strategy and the change is that you're implementing?
Sure. And I think you draw attention to 5 billion people. I think it's one of the greatest injustices of our time. One of the privileges of being Bill and Kathy's daughter is I read a lot of what my dad wrote in the 90s. And he said, the child with the cleft has led us back to the community to show us the need and get us to pay attention to the health system. And so using those 42 years of history, we've really partnered with the communities. We've really understood, we've listened to our patients, what it takes to go into these bigger cities to be turned away for care. And so after 42 years, we're going to really start to pay attention to how do we use education as our multiplier to educate and train more healthcare providers in those communities. So we call it the hub and the spoke model. I would say think about Delta Airlines, right? Their big hub is in Atlanta, and their spokes are in all of these different communities out there. So we will use the hub as a training facility and to train and educate more providers. And then we will use the spoke to really implement that training and take care of essential surgeries. Yes, around cleft, but think about it when Operation Smile isn't doing those surgeries. Think about the care that will be provided if you train the surgeon, the anesthesiologist, the biomed tech, right? We always see where does equipment go, the nurse and the pediatrician. And so then essential surgery can be taken care of better, but also we'll have more providers that are trained.
So we were talking about this a little bit before we started. Your focus is cleft, but to make sure we understand, I think as you were saying, plastic surgeons are plastic surgeons. Mm-hmm. So it sounds like what you're talking about is to be able to expand to more types of surgeries. Can you give us, what's an example of something?
Sure.
else?
So we work in Rwanda. We work in 37 countries around the world, but I'll just use Rwanda as an example. 13 million people in a country. they had 2 providers, 2 surgeons across the entire country. So I think what we did as Operation Smile is we went in and we partnered, we understood what the need was. And so 2 years ago, we started to do training with more providers. So now they have 5 plastic surgeons in this country, and we're really proud that 6 more are being trained this year to provide surgery. So education is the multiplier. I would also say that we need partnerships. All of you around the room are here because we want to really make a change in the world. And so through essential surgery, I think we can make that impact. We can provide more access to our patients, but then we can use education as a multiplier to train more medical professionals on a global scale.
Can you imagine 2 surgeons in an entire country? And now it's up to 5, and will be 11, right?
That's right.
What, just so we understand, like, what is the actual need? Like, how many surgeons do you think the country needs?
Well, they say that there are about 2.2 million more surgeons that are needed for the 138 million surgeries around the world that need to be provided. So Operation Smile, I think, is doing our part, but it is all about partnerships. We partner with the Minister of Health. We partner with the local community of medical professionals. We partner with corporations. Some of them are here today. We partner with other NGOs and INGOs on a global scale. So it is going to take all of us to really be able to provide that impact.
You're providing the training and bringing medical professionals in to a hub and training them. What about equipment and other supplies for the hospitals that they go back to?
Sure. So we always make sure that there is equipment and supplies for safe surgery. So, you know, every single one of our sutures comes from Johnson & Johnson. We use Mindray anesthesia machines. So there's a lot of companies out there that support our efforts through gifts in kind. And then wherever there is a need to make sure that we have that right equipment. But, you know, I would say that, you know, in the 37 countries that we work in, there's always barriers that we face. Every country is a little bit different, but that's why partnerships are so important to make sure that the needs are met and then education is also met so that surgery can be done correctly.
So what makes a hub, you know, you cited Rwanda, which is a great example, but what is it about a culture or an organization or a system that makes the hub and spoke system work? Can you talk a little bit more about that and what your partners need to?
Sure. So, I mean, I would say to you, we're learning. You know, Operation Smile is a very innovative organization. We like to listen to, you know, what our volunteers face. And I think it's really important for people to also understand 82% of our volunteers come from the countries that we work within. We're a locally led, globally supported organization. So I think it's a lot of listening and learning together. Innovation is going to be really important as we drive to the future. We hear stories of lack of access, barriers to care. How do we provide more impact? We also hear stories of what our patients face, right? They pool their resources to come into the bigger cities, to be turned away because their child maybe was sick and they couldn't have surgery. So for us, and I go back to what my dad said, if we can provide care closer to our patients, we can listen to them, we can understand the need, then we can really provide that care closer to home. And I think that's the gift that Operation Smile has really been able to give over 42 years.
Well, the world has changed a lot since your dad started this, right?
Yes.
What are the biggest obstacles today, would you say, that might not, you know, that are new or recent or just, you know, real impediments that you're trying to overcome?
Well, I mean, you know, I think we highlighted it a little bit. There are barriers to care, you know, for our patients. But also, I would say that education is a multiplier. How do we train and educate? You know, when cleft surgery is not being done, think about the care that is provided into these communities. Any patient that comes in to have surgery will be done more safely. And we call it the ripple effect. Operation Smile, after 42 years, we will be there for a long time. But how do we stimulate and really draw attention more to, what is going on in these communities? Really have the governments pay attention and have corporate partnerships on the ground to really come around this organization and provide better care.
One thing I know that is, I wanted to talk with you a little bit about shortages, and I know anesthesia has been a problem in many countries, getting anesthesia, enough of it to do surgeries. Is that something you're encountering, and how is that dealt with?
I would say it's nothing, we're always, 37 countries, different barriers, but I would say we want to train and educate more providers. Anesthesia, my dad said, 90% of the surgery is done by, or 10% of the surgery is done by the surgeon. The other 90% of the surgery is done by the anesthesiologist, right? The nurse, the pediatrician, the biomed tech. So if we can partner more, educate and train using our hub and spoke model. We also have exchanges with universities in the United States and other countries. We have Sweden here. They've really been able to provide for us exchanges with, our countries back into those bigger universities. So anesthesia, yes. It's one of the most important things, right? We go on a surgery table here.
Don't want it without it.
Exactly. So that's why we call it the Big Five. And so anesthesia is probably one of the most important things that we, provide and also provide training around.
What about, this is an incredibly innovative time in science and healthcare. What do you see as the greatest innovation needs right now?
Sure. Operation Smile is a data-driven organization. It's really important for us to learn what our patients face. Really understanding the reason why children were born with a cleft. You and I talked about that backstage, right? So some of what we've learned a little bit is that there's open fires that our patients, are cooking over, or the moms are cooking over. So how do we as an organization really understand the research around being born with a cleft? So we're learning about that. I think we're learning what are the right supplies and equipment that are needed for safe surgery. I think also education, right? How do we provide more care to these providers that they would never be able to get access to? So I think that, data helps us to really gain insight, and we're really trying to baseline our data around barriers to care and access right now.
So what is your ultimate goal here? Where do you want Operation Smile and your partnerships in this whole hub and spoke model to be, say, 5 years from now or 10 years from now?
Well,
let's go with 5.
Yeah. 42 years of history. I look around the room, you all sit in these incredible seats. There's a QR code up there. Please go and look at it. It really talks about the hub and the spoke model. But I would say to you, Operation Smile is here. We're committed to the work that we've done over 42 years, but we're still learning. And I think a lot of you who sit in the audience today, you're probably learning, whether you're from a government or a corporation or a nonprofit. Partnership is going to be really important, right? 5 billion people lack access. So how do we collaborate more on a global scale? We're learning 37 countries. Every country is different in what we face. And so I would say we've opened our mind. And we really have amazing staff on a global scale out there. We are doing a roundtable today where we have a partner from Africa who's really going to teach us and educate us to what the barriers are that we face. But learning together, being really innovative, data is something that will be important. And I would say come with us. We welcome you to really explore what Operation Smile does. If you're in some of these countries, we have offices all around the world, and we'd love to really provide the gift that I've been given and a lot of our colleagues of what our patients go through, but really understanding the need of access and impact. We want you to partner with us.
The world is really moving more local,
Yes.
as you said.
Yes.
And so maybe you've been on the vanguard of this. Well, it's been great to be up here and talk with you and learn a little bit more about the needs in surgical care around the world. So thank you,
Yeah,
Kristie
thank you,
Magee
Betsy.
Porcaro. The QR code is there, and thank you all.
Thank you.